Hi, my name is Tony Romero.
Hi, my name is Jasmin Miramontes.
Hi, my name is Diviya Rajesh, and we work in Dr. Todd Venturo's lab in the Department of Pharmacology.
In the laboratory, we study.
Pain.
More specifically, our goal is to improve the efficiency and reduce the adverse side effects of pain-alleviating pharmaceuticals, such as morphine.
Common side effects of pain-alleviating pharmaceuticals include sedation and loss of motor function. That being said, how can we measure the effect of a drug on motor function and coordination?
So this is where the use of the Rotarod comes into play. So what is the Rotarod, you may ask?
A Rotarod is an apparatus that assesses the effect of a drug on motor coordination and fatigue resistance. The machine consists of a rotating plastic rod that resembles a miniature treadmill. It measures the motor coordination of a mouse by recording how long in seconds the mouse can walk on the rotating rod.
In order to determine the effects of a drug, we must first establish a baseline, which refers to the latency and behavior of an untreated or naive mouse. The baseline will serve as a standard of comparison when you begin to test the effects of the drug.
The next step is to calibrate the machine according to your study. One of the major steps in this process is adjusting the speed of the rotating rod to an appropriate setting. The mice are then carefully placed onto the rod, which is suspended about 8 inches off of the ground.
There are multiple safety measures implemented to prevent injury or distress to the animals. Before the mice are placed onto these rods, they must undergo some preliminary training to become acclimated to the system. Additionally, the distance of this fall has been proven to not cause harm to the rat's bones or internal structures.
Once the rotor is initiated, the mice are placed on the rod where you can observe the animal's ability to keep up with rotations, hence testing their endurance and coordination. When a mouse falls, the rod stops moving. Upon the mouse's fall, the impact triggers the end of a timer which records the mouse's time on the rod in seconds, formerly known as its latency.
After a baseline is established, the mice are given the pain-alleviating drug that is being tested. The same procedure used to establish baseline is repeated every 30 minutes for 5 hours after the drug is administered to test for changes in the motor coordination of the mice. Shorter latency, frequent falling, and frequent slipping are often common signs of compromised motor function. This allows researchers to examine the adverse effects of a given pharmaceutical on the motor skills of a mouse.
While we know that falling, jumping, and freezing are all different ways in which the mice may be removed from the Rotarod, we have little insight in regards to what these different responses may indicate.
Is purposely falling or freezing an indicative sign to another side effect we haven't yet seen?
These are the questions we will further explore in our lab.